As part of President Trump's DOGE workforce reduction initiative, we're going to streamline HHS to make our agency more efficient and more effective. The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000.
The U.S. Department of Health and Human Services announcing today it is cutting 10,000 full-time employees on top of another 10,000 retirements and voluntary resignations. Health Secretary Robert Kennedy Jr. there says the rate of chronic disease and cancer has increased dramatically over the past several years, and he says change needs to be made. He says HHS will consolidate from 28 to 15 divisions, including a new administration for a healthy America. According to HHS, the workforce reduction will save $1.8 billion a year. But will these cuts impact any of the services you receive? We continue to look into this at a local level for you. And today, I went to Horizon Health in Gettsville to see if they expect to be impacted.
I am Brandy Vandermark Murray, president of Horizon Corporation. We offer comprehensive behavioral health care services across Western New York.
Brandy Vandermark Murray says while there is still a lot of work to be done, progress has been made over the past several years when it comes to mental health treatment.
Talking about mental health and substance use has less of a stigma, and that's important because they then reach out for help and they say, I'm not okay, and they know how to access resources differently than previous generations.
Important resources that Brandy worries could be impacted by cuts to the Department of Health and Human Services.
When we have a large organization at the federal level consolidating and laying off 10,000 people, that potentially can increase administrative burden on programs that are providing services for patients. Currently at Horizon Health and Horizon Village, we aren't impacting immediately.
Brandy says they will continue to advocate for important funding.
We don't have a ton of the federal funds for grants. The bigger concern, obviously, for us would be if they touched Medicaid. Our patients, use Medicaid, managed care.
HHS says essential health services, including Medicare and Medicaid, will remain intact. Health Secretary Robert F. Kennedy says the cuts will save $1.8 billion a year.
We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service. I want to promise you now that we're going to do more with less. No American is going to be left behind.
Brandy says they will continue to monitor the changes, but wants to assure patients if they need care, it is available.
And we are sound and we're secure and we're here for our patients. And so we want to be proactive in that approach.
She also says last year overdose rates did decrease, but thousands are still losing their lives to overdoses and suicides. If you do need help, we do have a link to Horizon Health resources at WKBW.com.